Welcome to this session on the Community-Based Monitoring System, or CBMS, where we will be presenting the uses of CBMS, particularly on monitoring the impact of shocks, as well as the impacts of policies and programs. For the attendees, please post your questions and comments at the WOVA chat box for this session, and I will read the questions during the open forum. Please indicate who you would like to respond to your questions. This session aims to showcase how the Community-Based Monitoring System, or CBMS, can provide necessary inputs and complement existing national statistical and data ecosystems in addressing crucial data gaps and requirements by duty bearers for the design of appropriate policies and interventions, more focused targeting, and impact monitoring. So on behalf of the CBMS Network, which I lead, I'm Celia Reyes, we would like to present to you today some of the experiences in implementing CBMS and also some insights. Monitoring of impacts of shocks is necessary to be able to respond to the impacts of natural disasters, pandemics, policy shocks, and other developments. Furthermore, it's important to track also the impact of government policies and programs on the households and communities to see whether these interventions are achieving the desired outcomes. However, there are challenges on how to be able to monitor impacts. These include, first, the availability and access to timely and disaggregated data to be able to point out the nature and extent of needs and disparities across population and communities. There are also very limited data coming from national statistical offices that can be used by local governments. Second challenge is the limitations in local capacities in processing and analysis of indicators for appropriate program action. In the Philippines, for instance, there's no statistician position in the municipal and city levels. We have found the Community-Based Monitoring System, or the CBMS, useful in tracking the impacts of shocks and interventions, and we will be sharing with you today the many uses of CBMS for impact monitoring, among other uses. The CBMS is a tool designed to provide policymakers with a good information base for tracking the micro-level impacts of various adjustment policies and policy shocks, particularly on the vulnerable groups in the society. CBMS was first developed and pilot tested in the Philippines in 1993 and has been adopted in local contexts in more than 20 countries in collaboration with partners from the government, academe and research institutions, non-government organizations, and development partner agencies. Development and related capacity building activities and the implementation and applications of the CBMS methodology and tools are spearheaded by the CBMS Network Office based at De La Salle University Angelo King Institute in Manila, Philippines. The CBMS was developed in response to three concerns. One, the need to monitor the micro-impacts of macroeconomic adjustment policies and shocks on the vulnerable groups of society. Two, the lack of regular source of disaggregated data that can be used for policy making and program implementation. Third, the demand for tools by local governments, particularly in decentralized countries like the Philippines, to facilitate transparency and accountability in the delivery of public services. The CBMS has been designed to provide the necessary data that can be used for the following: diagnosing the extent and nature of poverty, identification and analysis of the causes of poverty, design of appropriate policies and programs, program design and targeting, impact monitoring. It also aims to facilitate improvements in transparency and accountability in local governance, and it also empowers communities and promotes participatory decision-making. In the Philippines, CBMS has been implemented in more than half the country, with the local governments investing in the monitoring system. The local governments use their own resources to conduct the CBMS to be able to generate data that they need for evidence-based decision-making. In 2019, a law was enacted institutionalizing CBMS in all cities and municipalities. CBMS has also been pilot tested in selected sites in 29 countries with the support from the International Development Research Center of Canada and the Department for International Development of the United Kingdom through the CBMS program of the Partnership for Economic Policy, or PEP. CBMS has the following key features. One, it involves a census of all households in a community using a structured set of tools and training modules. Two, local government unit-based while promoting community participation. Three, taps existing LGU personnel or community members as monitors. Fourth, generates a core set of indicators to capture the multidimensional aspects of poverty. Fifth, uses freeware customized for CBMS data collection, processing, and poverty mapping to make it affordable for local government units. Sixth, establishes database at each geopolitical level so data can be used at even the lowest level of government. And sixth, it's conducted at regular intervals. CBMS uses digital technologies to collect, process, and visualize data. We have developed a data collection tool using tablets and a processing tool to automatically generate a core set of demographic, social, and economic indicators. We also use freeware to visualize the spatial data that are being collected. CBMS generates data that can be used for the following: localizing the Sustainable Development Goals, or SDGs, evidence-based planning and budgeting, appropriate design of social protection and safety net programs, targeting of eligible program beneficiaries, and monitoring impacts of shocks at the local level. CBMS generates the necessary local level data and their desired disaggregation for evidence-based decision-making. Since it is a census, meaning it collects data from all households in the community, all the desired disaggregation can be generated. CBMS can also monitor the impact of shocks, such as the ongoing COVID-19 pandemic. Data for a village in the Philippines shows the economic lockdown during the pandemic has led to higher unemployment rate and consequently higher poverty incidence. CBMS also generates panel data that tracks movements in and out of poverty. In addition to generating information on chronic and transient poverty, this highlights the importance of having adequate safety nets to ensure that the vulnerable do not fall into poverty, or if they do, they're able to recover more quickly. This particular slide shows the impact of the priority given by a particular local government in the Philippines to education after noting that school participation rate is lagging behind in some areas, as indicated by the red and pink shaded areas. With appropriate programs, they were able to reduce the proportion of children not attending school within a span of 3 years. In the case of one province in the Philippines, data on access to electricity was used as basis for their electrification program. The different rounds of CBMS data collection show that substantial progress has been achieved in access to electricity from 2000 to 2014. This shows how CBMS data has been used to identify one of the most pressing problems in the community and the impact of the response. The dots represent households where red dots indicate no access to safe water, and green dots represent households with access to safe water. After a water supply project has been implemented, the green dots have increased, signifying that a larger number of households now have access to safe water supply. Today, we are very pleased to have with us 3 experts who have implemented CBMS in Indonesia, Ethiopia, and the Philippines, and they will be sharing their experiences and insights. The first speaker will be Dr. Sudarno Sumarto, who is a senior research fellow at the Smero Research Institute, wherein he also served as the first director of the institute and a policy advisor of the National Team for the Acceleration of Poverty Reduction, Office of the Vice President of the Republic of Indonesia. Dr. Sumarto is an economist and a recognized researcher and expert in evaluation of poverty reduction and safety net programs with several publications in the fields of education, health, employment, social protection, and other poverty-related issues. He also served as consultant for policymakers of various ministries in Indonesia. He spearheaded the pilot CBMS project in Indonesia in 2005 and is also a member of the PEP CBMS Research and Policy Advisory Committee. He holds a PhD and an MA both in economics from Vanderbilt University. Our second speaker is Mr. Abel Tewolde Mehari, who's a lecturer and researcher at RC University, Ethiopia, where he also served for 3 years as head of College of Business and Economics. Mr. Mehari is currently pursuing his PhD, specializing in human resource management at Arba Minch University. He served as project team leader for the development and pilot test of CBMS in Ethiopia from 2015 to 2017, which applied CBMS to examine issues on poverty, youth unemployment, and entrepreneurship. Mr. Mehari was also involved as principal investigator during the expansion phase of the CBMS project from 2017 to 2019, wherein CBMS data was generated and utilized to examine financial inclusion and youth entrepreneurship and for the preparation of a local SDG report. Both projects were implemented as part of the CBMS program of the Partnership for Economic Policy, or PEP, and supported by IDRC and DFID. He has several publications in the areas of entrepreneurship, poverty, and inequality. Our third, and definitely not the least, is Mayor Shell Crisel Lagman Luistro, who is the local chief executive of the city of Albay in the Philippines and is the first woman local chief executive of the city. Before being elected as the city mayor of Tabaco, Mayor Crisel served as congresswoman of the 1st District of Albay, member of the City Development Council, and also member of the Provincial Development Council, as well as director of the National League of Barangays. During her 6 years in Congress, City Mayor Crisel Lagman Luistro was able to pass into law several priority measures, including laws protecting women and children. Mayor Crisel graduated magna cum laude with a Bachelor of Science in Nursing and Public Health from Newman College in Pennsylvania, USA, and she also has a master's degree in Public Administration and Governance from the University of the Philippines, National College of Public Administration and Governance. At this point, let us welcome Dr. Sudarno Sumarto, who will share his experiences and insights regarding CBMS. Dr. Sudarno.
All right. Thank you, Dr. Celia Reyes, for kind introduction and also for gathering and also to the UN World Data Forum 2021 platform. I'm grateful for the opportunity, and today I would like to share our experiences in identifying and reaching the new poor during the COVID-19, including Indonesia's experiences in implementing community-based monitoring system. As also experienced by many other countries, I believe that economic crisis brought about by COVID-19 is the worst hit experienced by Indonesia in the past 50 years, 1998 Asian financial. Our economy contracted by minus 5.23% the first quarter of 2020. As a result, poverty increased by additional about 1.3 million during COVID-19. However, compared to the 1998 financial crisis, this time Indonesia's economic structure is relatively better. Indonesia took a major policy innovation starting in year 2020, partly motivated by the Asian financial crisis. First, we have a social protection system in place, even though not complete. Secondly, we already initiated the so-called social registry. Actually, we learned from the Philippines. We call it TTKS, covering the bottom 40% to assess benefit targeting. However, our social registry has not been updated fully since 2015. So it's already about 6 years obsolete. So this is in conjunction with Dr. Celia Reyes mentioned about the need of upgrade data. With the high churning, people moving in and out of poverty, it no longer accurately record poverty. In addition, as we all know, that COVID-19 not only hit those in the bottom 40%, but also beyond that group of. So what Indonesia has been doing in addressing this COVID-19, first they introduced a safety net and safety rope. While safety net is actually a program aimed to benefit those who are currently poor, safety rope is actually intended to provide transfer to those whose income have fallen, whether or not they have fallen below an absolute poverty threshold. So the government has focused on two things. The first is the provision and distribution of social assistance, and secondly, social assistance expansion to the middle class. Now come to the most difficult undertaking, which is data sources. With the challenges posed by the pandemic, the social registry remain key to distributing social assistance. But it needs to be complemented with the community aggregated data that is decentralized and has a bottom-up approach to identify the new poor and those missed out by the social registry. So there are two data sources for benefit recipient list here. The first one is on the social registry, that it has a name, address, and also welfare status. The advantage of having this social registry, it has a welfare status, so we can see about whose household are and what percentile of the distribution, and it has also national coverage. But it also has a high administrative cost, and it needs to be updated over time. While the community aggregate data, it has a name and address, use local knowledge to quickly collect the data, and can identify households at the margin that are missed by the national survey. But it cannot rank welfare status if not complemented by a follow-up survey and also additional staff at the municipality, which many countries are lacking in that department, and rely heavily on those communities, especially the local leaders, the local apparatus, and also district government. So in terms of the guardian of this data source for targeting in Indonesia, the social registry or DTKS is managed by the Ministry of Social Welfare or MOSA. It's a very centralized, while the community aggregated data is collected from the community, input from the citizen, village government apparatus, and solo local government administration. It has been stored at the village, at the sub-district and also district, and it's also goes up to the Ministry of Village. We have the so-called Ministry of Village in Indonesia. Now, the community targeting for rapid emergency safety net implementation in Indonesia. With the COVID pandemic in 2019-20, and also now, government already put in place several programs. The first three programs that is actually ongoing has been continued. The first one is on the conditional cash transfer, covering the bottom 20%, and then food voucher for the bottom 30%, and also a new program is electricity subsidy for the bottom 40%. But we know that the COVID-19 also hit those beyond bottom 40%, also those missed out by the social registry. So additional program has been put in place, and we use the community targeting mechanic in terms of to pick up those beyond bottom 40%, and also those missed out by the social registry. The third group of programs that's also been introduced, they are three program, which is about the health insurance, and then pre-employment card for scaling and upscaling, and also those working in the formal sector, especially those with salary below 5 million per month. In terms of the budget, it was only about 0.85% from GDP, about 134 trillion, and then increased more than double to about 338 trillion rupiah, about 2.14% of the GDP. Now let me share with you our experience in implementing community-based monitoring system, as was also mentioned by Dr. Celia. CBMS Indonesia was initiated in 2005 with the final support from the CBMS Network IDRC that Dr. Celia mentioned. We started with piloting in 2 districts, in the city of Cianjur and also in West Java, and also Demak in 4 villages to get the local specific poverty information and rank welfare. From that experience, Semeru, in collaboration with the city of Pekalongan, this is a small city in Central Java, working together to collect data, as exactly what Dr. Celia presented on the way how CBMS is being conducted. At that time, we used that method and CBMS approach to analyze the impact of global financial crisis and also climate change on households in the area. And then the result from that exercise has been used by the city of Pekalongan to propose additional budget to the central government, to the Ministry of Public Work, and also has been very useful to enhance and also improve the participation of the local partner, especially NGOs and academia. From that pilot and also implementation in the city of Pekalongan, Semeru, in collaboration with the PEKA, this is a Female-Headed Household Association, we conducted another CBMS nationwide in about 17 provinces. Finding from this CBMS initiative with the Female-Headed Household Association has been very influential in improving the way how Statistic Indonesia is being implemented, especially on the definition of female-headed household. As we found that it turned out, according to the definition that we developed together with a group of community, we found that around 30% of this area that we are visited has about 23% female-headed household, while at the national level, statistic is only about 14%. What have we learned in terms of targeting social protection so far? First, although statistic national level, Indonesia or maybe another country can identify district-specific poverty indicators, a perfect estimation does not exist in the real world. As a result, there is always significant leakage, meaning that those who are not supposed to be receiving assistance are getting it, and also under coverage within program deliveries. Those who actually supposed to receive the program but being missed out by the program. So the challenge in the CBMS implementation has been failure to engage with relevant stakeholders and recognize unique socioeconomic characteristics in the community, and also lack of participation from both community members and leaders at the stages of the program implementation. And lastly is the minimum involvement of the local government in supporting this kind of initiative. In conclusion, no targeting mechanism is perfect. Many countries combine several mechanisms to minimize errors and gradually expand coverage. The choice between top-bottom and also bottom-up approach depend on the local context. In Indonesia, community-based targeting has well complemented the top-bottom approach to social protection and to social registry, and successfully reached the new pool in time of crisis when quick response was needed. Several challenges still loom over CBMS implementation in Indonesia, and if overcome, CBMS could work as a more sustainable and cost-efficient way to complement the government's top-down approach in poverty targeting, especially in minimizing exclusion error. I believe that the Ministry of Health is now doing initiative of putting this community-based monitoring system in place, and hopefully in the future, we will have more complete data complementing the social registry with the local initiative. So when shock comes, we can respond immediately, not only budget from the central, but also from top up from the district government. Thank you very much, Dr. Celia, and I'm happy to entertain your question if you have any. Thank you very much.
Thank you, Dr. Sudarno. Dr. Sudarno raised a very important issue of being able to identify the new poor during times of crisis. And I think he will probably be able to explain a bit more about this during the open forum based on the questions I'm seeing right now. Okay, let us turn now to our expert from Ethiopia. Abel, may we request you to share your experience and insights as well?
Thank you. Thank you very much for the chance. The title of my presentation is CBMS for local monitoring of financial inclusion and entrepreneurship among the youth. First, I'm going to reflect on the rationale for CBMS implementation in Ethiopia and say something about issues related to this rationale. In Ethiopia, decisions are made haphazardly in the absence of vital or required data at local level. This CBMS in Ethiopia aimed just to develop the culture of evidence-based decision making at local or lower administration level. Through this, it can help also just to decentralize data collection and data utilization. And also, the other reason why we implement CBMS in Ethiopia is just that we are facing with lack of regular and up-to-date data. If you see, as an example, the latest national census of Ethiopia has been conducted in 2007. So since 2007, we didn't conduct any kind of national survey. This is due to the existing political instability and government change. Actually, it was supposed to be conducted in 2017, still has been skipped and not defined when to be conducted. So, and in addition to that, even with regard to the past conducted national censuses, disclosure is completely restricted. If you check the website of Central Statistics Agency, you will get only few data, which is less relevant. So due to those points, we have initiated to implement CBMS in Ethiopia. Now let's move to what type of that data have we generated with CBMS or using CBMS. The first type of data that we have generated is a multidimensional poverty indicator, both as at household and individual level. When we conduct or implement CBMS, we have conducted it in two phases, as phase 1 and phase 2. Aggregately, we managed to collect a total of data from 5,363 households and 19,746 individuals. And also we have collected data related to sustainable development goals and sustainable development indicators. So out of 17 goals of SDG, we managed to collect data for 11 goals. And also we have collected 34 corresponding indicators. And also the data that we have collected by the CBMS implementation are gender and age disaggregated. And also in addition to household and individual based level type of data, we have collected data specific to the use. In phase 1, we have collected 3,500 data of the use, which has helped us to profile entrepreneurship and related dimensions. In the second phase, we collected around 5,000 data of use, which helped us just to profile entrepreneurship, financial inclusion, and related dimensions. And now let's proceed to the findings, the core findings that we got by our CBMS implementation. That is the issue of financial inclusion among the youth. With regard to this one, we have seen 3 areas of engagement. One is about whether they do have bank account or not, or whether, second one is whether they are receiving credit or not, and the third is whether they have they are involved in remittance. So with regard to those 3 things, for example, with regard to having bank account, only 30% of the youth have a bank account, whereas 70% are without having a bank account. With regard to receiving credit service or loan service, only 1% of the users are getting credit or loan service. About remittance, only 18% of the users are receiving remittance. So all those 3 types of service indicates that the financial inclusion is at lower rate for the use in specific to the area where we have implemented CBMS. The other is the issue of entrepreneurship. Pertaining to the entrepreneurship, we have developed, we got gender disaggregated data for male and female. As you see, the total as an aggregate, only near to 4% of the youth are involved as an entrepreneur, whereas when we come to the female, only 3% of the female are involved as an entrepreneur. For the male, only 5% of the male youth are involved as an entrepreneur. Now let us go to key lessons learned on the use of CBMS data. Especially the issue of financial inclusion and entrepreneurship is attributed to different segments of community in Ethiopia. Thus, localizing monitoring at lower level administration is vital for decision makers and to find unique solution for the problem attributed to financial inclusion and entrepreneurship. And also we have trained local enumerators to help them to develop or build capacity in terms of data management. We involved the mayors, we involved the community in data validation. So those, the last 2 points indicates how much the CBMS data is, it has a quality because we have involved the mayors, we have involved the community just after data has been collected and draft papers has been generated. So this is all about the point that I want to reflect in this session. Thank you very much for your patience.
Thank you very much, Abel. And I think it's very interesting to highlight the issue of financial inclusion, particularly because during the pandemic, health protocol may limit in-person delivery of financial services. And so a more efficient way of delivering financial assistance would be the electronic transfer of funds. At this point, may we request Mayor Crisel to share her experience and insights as well?
Good day to everyone. I'm happy to present how we implemented the CBMS since 2008 until the present in our fourth class city, Tabaco City. Tabaco City is situated in the eastern coast of the island of Luzon, which is the largest island in the Philippines. The eastern side of the city faces the Pacific Ocean, and on the western side lies the majestic yet highly volatile Perfect Cone Bayon volcano. Sherlock Holmes, next slide please. Sherlock Holmes once said, "It is capital mistake to theorize before you have all the evidence. It biases the judgment." Today, evidence is as necessary to political conviction as it is to criminal conviction. As a first-term mayor in 2007, the first thing I asked for from our planning department was the most recent data on the basic demography and socioeconomic indicators of the city. Our planning officer gave me the 2000 census of population and housing, which was almost 6.5-year-old data. So when I was invited to attend the Community-Based Monitoring System National Conference in 2008, I grabbed the opportunity. The conference introduced to me how the city can generate own local data, analyze this data, and use our own data for development planning and programming. Next, please. This is one of my favorite slides. It shows the pre-CBMS and post-CBMS impact in designing programs. Before CBMS, all we had was second-hand data. After CBMS, we had our own first-hand data. Before, it was just merely projections. Now it's an actual census of households. Before, it was just personal perception, and now it's a personal account. It was vague before, but now it's clear. And a lot of politics went into play before CBMS, but with CBMS, it has been more transparent and apolitical. Targeting was shotgun approach before CBMS, and after it was specific, accurate, and evidence-based. Before, it was just for compliance purposes. But after CBMS, we transformed ourselves to really be needs-based, and the needs are identified not by government, but by the end users themselves. This was really very handy in monitoring and evaluating our interventions. Before, there was no benchmark, and now we had clear benchmarks. Before, there were just generic dictations, but now there were clear sets of poverty indicators which can be monitored over time. Before, it was difficult to monitor, but now the outputs were measurable, and community participation was the community was involved in the data gathering, interpretation, and even in the implementation. Next slide, please. This picture shows how a CBMS coordinator conducts her census. They would go to where the people are. So in this case, the ladies now are washing clothes near the stream. When the city introduced CBMS in 2008, after I attended the national conference, as our monitoring tool to localize the attainment of the Millennium Development Goals then, there were many questions. Why we should conduct another census when in 2007, a census was already conducted? My answer was straightforward. The results of the previous year's census will not be ready until the president approves it. And we needed first-hand locally generated data that will be readily available. After validation, it will take around 2 months so that local planners can use it for planning, budgeting, monitoring, and evaluating government programs and projects. So with CBMS, you are not just a number, you are a member. And as a member, your voices should be heard. Next slide, please. Okay, these are the CBMS core indicators that we have monitored since 2008 until 2018. There is a clear correlation between the CBMS indicators and the MDG, now SDG targets. So we monitor health and nutrition, housing, water and sanitation, basic education, income and livelihood, as well as peace and order. Next slide, please. This is one of the first poverty maps generated by CBMS. For someone like me who appreciates visual representations of data over numbers, the impact of this map was very powerful. The data shows that 19.6% of our children aged 6 to 12 are not in elementary school, and 34.8% of our children between the ages of 13 and 16 are not in high school. But what was obvious in this map was not just the number of children who are out of school, but where these children are residing. As you see, the red portions of the map are those with children with high number of out of school children. And they are located in our island and in the foothills of the volcano, in the mountainous portions of our city. So you can now ask, why are there more out of school youth in these places? Next slide, please. But aside from just having a map of the whole city of Tabaco, CBMS can provide a map for barangays or villages. So this is an example of a village map, which maps the proportion of households of children 6 to 12 who are not in elementary school. So with this kind of data, local leaders like our chieftain in the village can use this data to actually also intervene. And this they have done so. Next slide, please. Among the interventions that we did with knowing why our children are not in school was to give them school supplies for free. We targeted 40% of our elementary school population, and we gave them school supplies because, and when we validated the data per barangay, it turned out that most of them did not go to school because they were ashamed that they did not have enough school supplies, and they did not want to borrow from their seatmate. So if that was the reason, then government responded by giving them free school supplies. We also partnered with a Japanese NGO that donated hundreds of used bicycles, which we repaired and distributed to around 3,000 high school students, particularly in the island and upland barangays. You see, there was just two schools, high schools in the upland, which served 14 barangays, and also just one in the island, which served all 5 barangays. So access was a big issue. And these bicycles allowed them more access to school. Next slide, please. You may be familiar with this slide because this was shown earlier by Dr. Celia. This is our map that assisted us to get the Poder grant from ACID. It's the Spanish Agency for International Development Cooperation. Since we had our first-hand data, when the funders came in, we readily gave them the information that we needed to support our claim that we need assistance in terms of water system in the island of San Miguel. And you can now see the before and after pictures. As was mentioned earlier by Dr. Celia Reyes, the red spots signified those without access to water. And after the Poder water system project, many of those red dots became green. So we now can monitor the impact of the project, the impact of our decision to finance the water system project in the island of San Miguel. Next slide, please. These two structures were built after we realized from the CBMS census that most maternal deaths and child deaths were located in the island and upland barangays. And mainly because there was no time to bring them to facilities in the mainland. So time was of the essence. So building these two structures to support the medical and birthing needs of our women in the upland and island barangays, we have dramatically reduced maternal mortality and improved women's health and child's health. Next slide, please. Okay. We also use CBMS to target our pedicab drivers. When we wanted to campaign or advocate for male involvement in family planning, we realized that most of our virile young men were pajak drivers or pedicab drivers. And so we zoomed in on them. We called it macho talk. But after talking to the men, we talked to their wives or partners. So we called it women chit chat. But there's nothing informal or about chit chatting, because it really focused on family planning and responsible parenthood. So CBMS was also instrumental in allowing us to identify our target groups. Next slide, please. We also we were able to use CBMS data during the COVID-19 pandemic. We were able to target the 45% social amelioration program beneficiaries out of 38,000 families in the city. That was really a big political issue. But with CBMS, we depoliticized the process of targeting who should receive social amelioration. So for those who were not able to get assistance from national government, the city provided for them cash assistance and rice assistance. We also have a citizen's ID card because, okay, thank you. Can we go back to that previous slide? Okay, just sample pictures of the SAP or the Social Amelioration Program payout. and the rice distribution. Next slide, please. We also have the CBMS ID card, which became very handy because most residents do not have national IDs or national government issued IDs. And so with CBMS ID card, we were able to give them a supporting document, an ID issued by the local government so that they can claim the assistance, without which they would have had a hard time. Next slide, please. Okay, there were many challenges since 2008 to the present. Mobilizing community participation was still a big challenge. A census, there's always a fear of increase in taxes, because you have to divulge in economic information about the household. We need to build local capacities of enumerators and even mobilizers. There's always limited resources, but this is costly in the beginning, but quite effective. And so in the end, it is less costly and more cost effective. Partisan politics, sometimes there is mistrust, and so they refuse to participate. Commitment and sustainability. Well, we had a solution for this. We made an ordinance. So on utilizing the CBMS, using the CBMS, and using the MDGs, now the SDGs as our template for development. So whoever is mayor, he or she has to follow what is in the ordinance. But now it's not a big problem since CBMS has now been passed into law and the whole Philippines will be applying this. Difficulty in comparing statistical data is still a big issue. So with CBMS under the NSO, now the PSA or the Philippine Statistical Authority, I think this issue will be addressed. Difficulty in getting accurate answers, especially on questions that are considered private information and delicate, like violence against women and children, teen pregnancy, mental illness, etc. Next slide. Lessons learned. Accurate and relevant data is vital in decision-making and poverty reduction. Targeted interventions are indeed cost-effective. CBMS gives communities a voice in decision-making. Public service delivery is depoliticized, and there is an increase in government accountability and transparency using evidence-based data. Political commitment surely is the key to sustainability. Next slide, please. To conclude, evidence-based planning and programming help decision makers and policymakers achieve our goals. Wise public investment is key to reducing poverty and addressing inequities. Timely and accurate data to measure progress and plan for investment, as well as for good analysis and policy application, is indeed crucial. Real benefits of development quickly accrue to communities when the locals are involved. And CBMS is a tool, like any other instrument, is value neutral. Its value and significance depend on how it is utilized. Next slide. Just marvelous po.
Thank you, Mayor Crisel. It was very enlightening to hear about how a policymaker, in this case, Mayor Crisel, has actually used and responded to the data. So we have heard three perspectives, first from a researcher and policy advisor, a researcher from the academe, and finally from a policymaker. Let us now have the open forum, and the first question is from Lucy Roma from Kenya. How long has CBMS methodology been used in the area of development? Let me just answer this quickly. Although it has been developed in 1993, it was adopted province-wide only in 2000, still a long time ago, and then has been expanded to other provinces in the Philippines. And as I mentioned earlier, pilot tested in a few other areas. And Mayor Crisel shared earlier that she has been using CBMS since 2008. Second question is, how effective is CBMS for COVID-19 in developing countries? Perhaps I can ask Mayor Crisel if she wants to add to what she has shared earlier, and also Dr. Sudarno, because he also mentioned about how he sees CBMS helping in terms of responding to the crisis. So, Mayor Crisel, would you like to add to what you have mentioned?
On the uses of CBMS during the COVID pandemic.
Yes.
From being able to prioritize the beneficiaries of the social amelioration program, as well as monitoring the movement of people, especially those who used to work outside tobacco, like our OFWs and also our workers in the NCR, or the National Capital Region. They were very, we actually updated our CBMS during the height of the pandemic in 2000. We conduct CBMS every 2 years. The last time was in 2018, as I've showed in our chart. We were not able to do one in 2000, but because of the updates in the data, now many people were coming home. OFWs were lost their jobs and they had to come home. We were able to update our data. So now we know who to refer to programs of the Department of Labor and Employment, who needed assistance, what kind of livelihood is best for them. So we have incorporated that in our CBMS, because we do, Celia, have our own CBMS office under the planning department. So it's very easy to depoliticize choosing the beneficiaries if you have hard data and it is evidence-based. So when it came to requesting budget from the Sanggunian or the legislature, it was easy for me once I showed them the updated data from the CBMS. So it's easier to fight for a cause if you can substantiate the data behind why you are, like for instance, requesting new funds.
Thank you, Mayor Crisel. Dr. Sudarno, would you like to share your thoughts?
As I said in the presentation, that our social registry has missed out those even in the bottom 40% because it's not regularly updated. So there are a lot of exclusion error. In addition, there are also people above bottom 40% who also got hit by the COVID-19. So the government, in addition to transferring the traditional social system, has also distributed cash transfer to the village. They call it a village cash transfer, managed by local. We believe that during that deliberation, some of the areas we implemented the community-based monitoring system in the past has been used to determine about who should be receiving the assistance, even though the process is renewed because there is a new deliberation in the community. But in addition to that, the experience that we work with this female-headed household association in 17 provinces has also been used to propose to the village head about who should be receiving this cash transfer during the COVID-19. It also was exposed at the national conference within the parliament. We are grateful. There are a lot of recipients of this cash transfer women, and most of them are also members of this female-headed household association that we have been helping them in the past to collect data through the CBMS monitoring system.
Thank you, Dr. Sudarno. Abel, would you like to share your thoughts in terms of how CBMS could potentially be used in Ethiopia at this time?
Okay, am I audible? Are you hearing me? Okay,
Yes.
Thank you very much for the chance, Dr. Celia. I was just visiting the area where we have conducted CBMS in the past, more recently, at the time of prevalence of the COVID-19. And I learned that they are using the data that we have already allows them to access just to provide an assistance for those who are in need of. Especially based on the report that I got from the local mayor in that area, they told me that especially the CBMS data has helped them just to track the total number of family size, the number of children, in terms of gender, in terms of age, etc., etc. So that it was really helpful for them to identify and directly provide the assistance for those who are in need. So I think it was supportive for them that I have actually uh, got report from the area. Thank you.
Thank you for sharing that. Let us move on to the next question. Which organizations use the CBMS in Tanzania? The first project was implemented in Dodoma municipality, led by Rangya Muro. And this was implemented in Nala village and Dege ward in Dodoma. And the second phase of the project was actually implemented by the Institute of Rural Development Planning in Bukoba and Muleba districts. That's in 2015 and 2016. Okay, for the fourth question, are homeless people such as those living in streets and carts included in monitoring using CBMS? How can the homeless be monitored in the community? So perhaps I can ask the three whether they covered the homeless or those living in makeshift housing during their CBMS implementation. So perhaps we can start with Mayor Crisel.
Yes. We do monitor all households. So when you mentioned, Dr. Celia, do we monitor those living in makeshift homes? Yes, we do. In fact, because of CBMS, we can now identify who are living in makeshift homes, who needs to be relocated, and who are living in danger zones, who are also in need of relocation. To date, Tabaco City has 8 relocation sites. I just like to say that when the pandemic hit us in 2000, I thought that it was just a COVID pandemic. But in the November of the same year, we were hit by 3 typhoons. And we were really devastated. The whole city was devastated. And CBMS became very important in addressing the needs of our now homeless, homeless residents. So because of the data that we have and our preparation in allocating a lot for resettlement, the National Housing Authority, through the Build Back Better program of national government, has identified Tabaco as the recipient of 2,361 housing units. And now it is presently ongoing. 100 units will be delivered this December. So CBMS has played a major role in identifying our homeless and also depoliticizing the whole process of identifying the beneficiaries.
Thank you, Mayor Crisel. Dr. Sudarno, would you like to share?
Yeah.
Yes.
Very quick in this question. It's a very interesting question. But to be frank, from the experience we had with the city of Pekalongan, actually, because if the census says, you know, that community-based monitoring system is using census, actually we try our best to cover everyone living in that municipality. But of course, probably we also miss out some of them which are not being invited, or we could not identify some of them who are living in support squatters. But we do agree that communities, unique communities, has to be taken into consideration in the future enumeration, because even the national statistic usually did not cover those living in squatter and also homeless, because it has a resident, you know. The census block census has to be a resident. Thank you, Jerry.
Thank you. Abel, would you like to share your experience?
Okay. Thank you, Dr. Celia. In Ethiopian context, I don't know whether we have addressed homeless or those who are living in the state or not. when you see our data with regard to those who are home where they are living, we were having a different types of classification. One of it was those who are living in a makeshift homes. If that is the case, I think we have addressed the issue of homeless or those who are living in the streets. That's the point. Thank you.
Thank you. So I think all of you have responded to the question of Shirley Ocampo. Now let's move on to the next question from Christine Cynthia Kayongo from regarding the effectivity of CBMS. How effective is CBMS, especially in rural areas where there is no internet? Because we try to use, digital technologies, but her question is, how effective is it in rural areas where there's no internet? So perhaps I could start with Abel this time, whether you had to make some adjustments in the rural areas because there's no internet. You're on mute.
Could you make it the question again?
Yes, the question is, because we said that the general design of CBMS is that you can actually use tablets to collect the data.
Yeah.
But there would be some areas in the rural areas in particular where there's no internet. So how do you adjust your data collection to take into account the lack of internet connection?
Actually, we didn't do anything. Actually, the area where we have engaged in for our CBMS implementation were covered by network, internet network. So we didn't face any kind of problem with regard to not having an internet connection. But we are thinking that in case certain interruption happens, we're using a backup devices whereby we can collect the data on the tablet, and at the end of the session, at the end of the day, we can transfer the data that we have on the tablet to the laptop or to the computer, so that we can reach into the area where we can get an internet connection and upload into the server of CBMS International Network. That was our planning to do, but fortunately, we didn't face that kind of problem in our way of implementing CBMS. Thank you.
Thank you. Mayor Crisel, did you encounter any problem regarding internet connection?
When we started in 2008, we used the printed questionnaire. You used the printed questionnaire, and then we migrated to using the tablet. So we can always go back to the questionnaire if the printed questionnaire if problems occur. So I don't think that would be an issue in tobacco. The main issue actually is the tablet. The tablet questionnaire on the inside the tablet, you really have to teach the enumerators how to use it. So I think it's more in that area. And of course, there are areas that have low internet connection or even no internet connection. But we can always go back to the pen and paper.
Thank you. And finally, Dr. Sudarno, would you like to share regarding how to do it in rural areas?
We are relatively okay actually with the connection. Maybe only very remote areas, very small part of Indonesia has some problem with it. But when we implemented CBMS the first time, we used a printed questionnaire and then, fill in the questionnaire like traditional way. But during COVID-19, many surveys that has been using phone survey and also internet is actually doing relatively okay in terms of the response rate is still very high. So we are lucky in that department actually that we are doing okay for. But that's a good question because, with all of the sophistication that Mayor Tobacco mentioned, if we don't have any connection using tablet and things like that, it's going to be, unreliable data. So that's good that in the Philippines, there's no problem with it.
Thank you. Actually, I just want to mention that the system has been so designed that data can be collected even without internet connection, and the data can just be uploaded later on when the enumerator already has access to internet. I'm sorry, but we don't have any more time for the open forum. So at this point, let me thank our panelists, our experts, Dr. Sudarno Sumarto, Abel Tewolde Mehari, and of course, Mayor Crisel Lagman Luistro for sharing their expertise and also their insights. And we hope that the attendees got some lessons and also some future directions for the work that they're doing. Again, thank you everyone, for our panelists and for the attendees. Bye, everyone.
Bye. Thank you.
Thank you.
Thank you,
Bye.
Dr. Celia. Thank you, Abel. Bye-bye.
Bye.